What if I have ST segment elevation in my septal, anterior, and lateral leads? So V1 through V6, my precordial leads. That is called an extensive anterior wall MI, or the Widowmaker. It's called the Widowmaker because 80% of patients will die from having the Widowmaker. So this all comes from a proximal occlusion of that left coronary artery. So if you see where this arrow is pointing, if I put a clot right there, I'm going to block everything downstream of that. So I'm going to block my circumflex artery, which supplies my lateral wall and my posterior leads, which we're not talking about today, and my left anterior descending artery, which supplies V1, V2, V3, V4. So my septal and my anterior walls. So we've always asked, when Adam and I are teaching this, we always ask students, if you had to have an MI, if I told you you're getting ready to have an MI, and I let you pick where you put it, you would want to put it as distally as possible, right? You would want to put it as far down in those branches as you possibly could, to where wherever that occlusion's happening, there's very little real estate distally to that that's going to be affected by it. So when we have clots that happen proximally in our right main coronary artery or our left main coronary artery, just know that everything downstream of that is going to be affected, and we are going to see infarct and injury patterns with that. So this is when we have ST segment elevation and leads V1, V2, V3, V4, V5, V6, or at least V2 through V5. And that is the extensive anterior wall MI, or the Widowmaker, and about 80% of those patients are going to die with that. So I'm going to jump over for the sake of time for this section. So this is our extensive anterior wall MI pattern. So I have ST segment elevation in V2, V3, significant ST segment elevation in V3 and V4 and V5. I don't necessarily have it in V6 yet. It will be there if this patient doesn't get reperfused soon enough, but I have it in one of my septal leads and an anterior lead. So those are numerically consecutive. So minimally, I have an anteroseptal wall MI. I continue over. Yep, I have ST segment elevation in V4, which is an anterior lead. I come down to V5, which is a lateral lead. I certainly have ST segment elevation in V5. Now I have a septal involvement, anterior involvement, and lateral involvement. That's an extensive anterior wall MI. There's an 80% chance this patient is going to die from this.